The Rogue Treatment Podcast is back, and James, I've got some good content for you today.
I know I haven't seen some of this content, so I'd like to see where this goes.
Well, as per usual, and for our viewers, James has not been prepared, no. He said, "You bring the content, and I'll bring the talking."
Yeah, because you don't talk,
and you talk too much.
I talk too much,
and you don't bring any content. You know, there's no accountability. Anyways, moving on. Like it or not, but you're probably going to hear James talk too much today, but that's okay. James, I'm not sure if you've seen in the news. I want to talk to you about back pain.
I don't watch the news, so I haven't seen it.
Yeah, you don't watch the news, do you? Why is that?
Nothing important to see.
Moving on. Well, I've seen it on the news myself, and then I saw it in a lot of the physio forums that finally we've been given some recognition as physios that back pain actually, you know, can be improved by physio itself, and it's, I find it funny that we're talking about that, and obviously, like in my voice, you can probably tell that it's a surprise that we've actually been backed for once, because we often hear that with studies and articles and these sorts of things that, you know, physio isn't often like recognized as a first point of call for back pain and things like that. So it was recognized on the news this week, and the physio world has blown up and gone, guys, get on to this. Look at us. We're finally being like noted as like, you know, we can actually do something in back pain. We've known this the whole time, but now the media's come to as well.
I'd like to see this. Can we see the clip?
I can play it for you.
Okay.
All right. You're going to have to get your headphones on here, mate.
Okay.
There you are. All right. So, essentially, this was from... we're playing an ad here. But this was from Channel 7. And here we go.
Researchers at Macquarie University analysed 75 clinical trials and have revealed which treatments actually work long-term for lower back pain and which don't. They found combining physical therapy and activity with psychological therapies that target the mind offer the most effective and lasting relief. In fact, the combo has been shown to reduce disability by up to 20%. With 1 in 6 Australians living with lower back pain, that's 4 million people. The lead researcher tells 7 News it's time to move away from quick fixes.
Generally being active, you know, is the simplest thing that people can do. Not to think of our back as fragile or something where movement or activities are going to do harm.
The study also found while popular options like massage, injections or supplements may help in the short term, they don't hold up over time.
Wow. Wow.
The last bit's a killer, isn't it?
Well, I have a problem with that. Why are you laughing?
Because I drummed it up to you and I was expecting that reaction.
No, I have a problem. As a profession, we shouldn't be asking for this. What's being said in the physio forums, that'd interest me.
It's that, no, it's just the recognition that I was talking about before. Like, so long we've seen in the media where it's like, oh, you don't have to do anything. And there's... So
they're saying in the physio forums, oh, finally someone's giving us recognition that we can treat back pain.
Yeah, yeah.
You shouldn't have to wait for a news article for that. That's bullshit. You should not be demanding a news article for that. That is absolute rubbish. I can't believe that if in the physio forums they're saying, oh, look at us, we can help with back pain, we need 7 News to tell people that. That is disgusting. We know we can help back pain, and you shouldn't be demanding a news article to be able to do that. No. The reason that you need a news article to tell you that is because you're probably shit at your job. No, you should not be demanding that.
But I don't think it's them feeling that like that they need to be told. It's more about that now the media is telling the world that physio can actually physio can help with back pain.
No, they won't.
No, but that's what was on the news. So the media's telling everyone. Like,
generally,
not physios.
physios won't help.
Yeah, well, that's our problem. That's our problem.
That's what I'm saying. So that shouldn't be on the news, and physios should not be celebrating that.
It's because the media is telling the world that, you know, back pain, when you've got back pain, go and see a physio. Even though that last bit's a kicker where it's like, oh, well, like these modalities probably not going to help in the long term. But anyways, we'll get to that kicker. But it's about people, when they get back pain, they don't call physio straight away.
Who do they call?
Well, I don't think they do anything for the first part.
Yeah, a lot of people, we know that categorically. People let pain fester and you know, it's until they really can't do something, until they, you know, before they make that decision to go and see a physio.
Yeah, but then if the media is also telling people to not bother with going to see a physio and encouraging that, then it's just going to get worse.
Yeah,
so that's why I think the celebration is.
I'd like to know where people are going. And then that will give us the reasons why.
Well, I'll tell you where they're going. They're going to Google.
They're going to Google.
Or Instagram or TikTok.
For years, doctors and physios in this country have been working hand in hand, right? And medically, yes.
Okay.
Whether we like it or agree with it or think that it's
not
working or not working, the APA has lobbied the Australian Medical Association.
I know where you're going with this.
To the nth degree to have physios in hospitals, to have, you know, which I think is a good thing. Don't get me wrong. I'm glad that the APA has done that. But then if we need a news article to celebrate the fact, oh, physio helps with back pain, it means that we have been doing a shit job as a profession up until now if we need a news article to celebrate that.
It's pretty dour, isn't it, really?
I'm sorry. I just think that that's ridiculous.
But hold on a second. You have to give credit, like, you have to understand that it's not the physio world's going, well, finally the media is actually telling people that when they've got back pain to go and see a physio. You have to accept that. You have to accept. I know it's still frustrating that is what we're talking about, because people don't seek back pain, and the media previously has, and studies, and we get so cooped up in like, oh, what does the study say? What does the evidence say? And it's like, don't see a physio and don't do
that's
this.
what this says.
Yeah, well, I've got more for you.
We did an analysis of 10,000 studies or whatever. Macquarie University need to come out with that. 2 seconds ago, they were promoting chiros. Now they're promoting physios. Like, I just don't think we need this. I just don't think as a profession we need this level of exposure. If we need this level of exposure to be able to say to people, oh, you need to go see a physio, we're not doing a good enough job to promote ourselves as physiotherapists as a profession. And if we're not doing a good enough job to promote ourselves, something like this is just a blip in the radar. Yeah, we might get some extra back pain clients in the next couple of weeks, but that's it. But
no, I agree that we don't promote ourselves very well at all. We are actually horrendous at that as a physio industry. But there's also been, I mean, I know you don't watch the news, but on the news, they will constantly, fairly frequently, you would hear that back pain, new study has come out that this drug is the best thing to do. You know, back pain is caused by stress, and that's it. And back pain is correlated with whatever, right? And it's never like correlated with physios. That's where the celebrations come from.
Okay, that's good news. But again, we should have been pushing this for a long time.
The bigger picture, like you said, is that because physio is just not, we're just not promoting ourselves well enough.
We're not promoting ourselves well enough because we're not doing a good enough job.
Yeah.
Okay, we're not.
Why aren't we doing a good enough job?
I come back to the question: is you said, oh, but before they didn't know to go see a physio. People have still had back pain, so where do they go? What is their first port of call? And their first port of call is the doctors. If it's not the doctors, it's a massage therapist. If it's not a massage therapist, it's a chiro.
Well,
and we then need to go look at why are they the first port of call and not physio?
Well, because people are looking for a quick fix, aren't they?
Let's not blame people right now.
Well,
I agree with that, but let's.
I know where you're going with it, but like if you've got back pain, you're like, oh, I just feel it's time. I'm just going to go and get a massage, and then it'll like feel better. Well, I'm going to look on Instagram and see exercise, and it's helped this person.
Yeah,
so
I saw someone the other day promoting some.
Do a plank.
No, it wasn't a plank. It was like
It's for my core strength.
no, it was like a knee rehab program that was all online with some like really basic exercises.
Yeah.
It was a physio. He worked for us for a period of time.
Yeah.
And I was like, I cannot believe someone's promoting that. But at the end of the day, I come back to why are people not going to physios first? Then we don't need a news article saying, oh, go see the physio first. The reason that people aren't going to see the physio first is because as a profession, we don't do a good enough job to show people how we can help them. Because yes, medicines are a quick fix or some supplement or some drug. So when they go to the doctor and they're seeking a quick fix, that's what the doctor gives them. Right? Or when they go to the chiro or when they go to the massage therapist and they go, oh, I feel good after that, but it came back 2 hours later. Or I got a crack and I walked out, oh, it felt so good. And then 30 minutes later, I feel the same. And that's not me having a go at that, but that is the quick fix mentality, right? So what have we been doing as a profession for the past however many years that we've been in bed with the Medical Association to say, hey guys, this is how we can help. We haven't because there's so much infighting on how we can help. You know, we want to sit here and quote studies that have been around. You know, if they've done meta-analysis, those studies have been around for years. They didn't just come out yesterday. So
No, but that's what we should follow today, though.
yeah. So look, I'm really annoyed that
Evidence for the last 20 years, that's what we should follow today.
if
But
our profession
yes,
on the forums are celebrating that, that's very frustrating.
it's sad.
Yeah.
It's sad. I get that part. I wasn't expecting that reaction.
You weren't
that was
expecting
good.
that reaction.
You surprise me sometimes. Can you please just acknowledge that there's a little bit of like, you know, at least they're acknowledging it. That's a small step at least.
Yeah, I can acknowledge that, and I think that's good. Absolutely.
We are
I'm not
smashed
saying.
constantly. Physios are smashed constantly about like, you know, you don't need a physio. You can do it yourself. You do this, you do that.
But H, at the end of the day, right, I don't think this is the first news article Channel 7 has run that says that physical activity and physiotherapy will help with physiotherapy. I'm sure I've seen that 10, 15 years ago. And you know, it's a recycled article because Macquarie Uni have come out with some bullshit, right? At the end of the day, we also interviewed someone on the podcast last year that was on Channel 7 talking about her shit. It's just like a flash in the pan when we're not doing enough to get results for our clients. That's all I'm saying.
Why aren't we doing enough?
Why aren't we doing enough? Far out. Do we have time to go through that? Like
I said, guys, he wants to talk, so I'm just the bait here.
You said you had more information, more studies for me.
I do. Don't you worry.
So the question is, why are we not doing enough?
Why aren't we doing enough? Why aren't people going, like, why isn't there a strict correlation to, well, we said that. There's no, we're not the first point of call. Physios aren't first point of call. Regardless of what the media are saying, we're just not doing a good enough job as an industry to get people to outcomes. Okay, I guess that's one part of it, right? And not providing a good enough service, and then people just don't come. But why is that?
I think it comes back to we don't, as a profession, have a general consensus on how to help people. If you go to a chiro...
But that's what everyone says in our interviews.
If you go to a chiro,
to help someone.
A chiro knows how... Yeah. A chiro has a structured way of treating the spine and all that. And I know chiros have kind of gone away from that. I'm not trying to dig at chiros here, but chiros now are utilizing an integrated model. Yeah. But when someone goes to a chiro, they know that the majority of chiros are going to treat the same way. You may not get the same results, and there's the quality of the practitioner and all that kind of stuff, but there is a general consensus on how chiros would treat an injury. When you go to a massage therapist, there is a general consensus that the massage therapist is going to massage your muscles. Most likely around the area of pain, maybe
tightness,
beyond
whatever.
that.
Yeah.
Correct. What's tight, the massage therapist is going to answer.
Yeah.
So you know what you're going to get.
Yeah.
When you go to a physio, you're going to get one
Lucky
physio
dip.
that doesn't want to touch you and is going to give you basic exercise that you can get off Google. Another physio is going to, want to play with your eardrum in the back of your palate to see if that works. Another physio is going to, do hands-on and be a massage therapist and nothing else. Like another physio is going to use EPAs that we still teach in university, even though there is no practical application to it.
Yep.
So there's too much variability. And that's also the beauty of physio, right? But there's also too much variability on how we can help, right? And I think we then need to come back to what are we trying to achieve? We are trying to achieve an outcome for a patient. The best thing that we can do as a profession is explain to people that if you want to be able to run again, if you want this back pain to not be debilitating, if you want to, go to work and sit at a desk all day and not have to have back pain, you want to go play with your kids and be able to get on the ground and be able to move, you want to go to the shops and be able to pick up a 5 kilo, bag of shopping and not have your back pain work, there is a process to get there. Yes, there may be variabilities and different ways to do it, but we should be promoting that there is a process. All those studies that Macquarie University would have cited there in their meta-analysis would have had a process to get someone better, to show, oh, look, there's this percentage of improvement, right? But physios go in there and they go, oh, here's some exercises. You can self-manage now. Let's see how that goes. Here's this magic pill of a program that does this and plays with that, and you should be able to self-manage now. That is bullshit. People don't self-manage. People need direction towards an outcome. That's what chiros do well. That's what massage therapists do well. That's what osteos do well. That's what doctors do. But let's just take that and you can self-manage now. That is the fucking problem.
Yeah, yeah. And why is that then?
Oh, stop giving me the whys. Why?
Because I know I'm
education at
baiting
uni.
well
It's
here, but this
education
is
at
what
uni.
people need to hear. Like, yeah, education at uni, but like also,
Because how many people you said, like, we hear it in interviews when people interview with us, when you ask the question, why did you get into physiotherapy? What drew you
because
to
I'm
this
here
industry?
to help people.
Yeah. So innately, a physio needs to have that. A physio needs to have, the want to help people. But they don't have the knowledge on how to, because they're not prepared to. So the answer to why is they don't have the knowledge to help that person.
Yeah.
We're not prepared for that in uni. Now, I haven't been to uni for a while, but when I was at uni, we were not prepared for private practice, plain and simple.
Well, even now, I think it's worse because the generation that's coming out now spent a lot of time during COVID, and there's different arrangements there, and I think that people are coming out, they're very, very brainy. We've spoken about this before, and how book smart our physios are when they come out. Extremely book smart. Fantastic. Probably more book smart than you and I when we came out, let's be fair, eh?
Maybe you. Listen.
Oh, I don't know about you, mate. They were pushing people through with you, but...
I think they were with you. You got into ACU under par, right?
Almost dropped out several times, but here we are. Anyways, no, but like they're very, very book smart. And then because that being book smart has got physios through school, through university, they think that at the end of the day, they're going to think that the being book smart is going to get them through their career. And it's actually the opposite.
Yeah. There's a skill to then understanding how you're going to help someone. You need to know about the body. You need to know about the systems of the body and how they interact and where the muscles are and where the ligaments are and all that kind of stuff. That you need knowledge for that. But that's all a whole bag of knowledge with zero application. That's, I think, what the problem is. There's the knowledge is there. There's not enough work or not enough time spent at uni on how to apply that in a private practice setting. I think the hospital...
We're speaking about private practice setting.
Yeah, the universities do a great job in preparing people for the hospitals.
Absolutely. Yeah, and to work alongside doctors. But in the private practice setting, you don't work alongside doctors.
No.
it's a lot. Yeah, it's the books aren't going to get you through. When you're looking at a person, they are not a book.
No.
You know, they are their own individual with their own unique movement style, mechanics, personality, stresses,
Yeah.
all those things, different outcomes,
Mm-hmm.
and that's what you're getting better. You're not getting the book better, or you've not got knee pain, and then you just follow the script to get knee pain better.
Mm.
On back pain.
Yeah, let's go back to the back pain.
Back to the back pain. Obviously, at Switch, we try to give people a clear direction.
Mm-hmm.
I think that's really important because, like you said one of the biggest fallbacks is that we're not giving clear direction when people are coming in. When you said there's a beauty in physio where you go and see a physiotherapist and you're not sure exactly what you're going to get. At Switch, we're like, you know what you're going to get.
Mm.
You're going to get a clear understanding of what your injury is, where you really want to get to, and the steps to get there. And then we break that down into our unique movement patterns, which we're not going to get into. But you're going to get hands-on treatment.
Mm-hmm.
You're going to get an analysis that's not just from the textbook. Of course, there's bits and pieces, but we have our own principles. And you're going to leave with clarity on where I am, what I'm going to get, how to get there, how long it's going to take, and that's it.
Yeah.
And then you and the physio are working together and are accountable for that journey. And that's a big part of what we do at Switch, right?
Yeah, and I think, that then provides that clarity on what you're going to get. Every physio is then going to do slightly different treatments. That's the beauty of our profession, is that when you're looking at the body holistically head to toe, every single person is going to look at it different. Every single physio is going to look at it differently in a way to help solve that problem for that client.
Well,
that's why it's individualized care.
Yeah.
But the clear outcome is that you know what you came in for, you know how there's an approach to it, you know exactly the steps you're given the steps day one in an initial consultation of exactly what we need to do. And then we work towards that outcome. That gives clarity to the clientele.
Yeah.
That gives clarity as a profession on what we're doing. And I guess where my frustration comes in is because we're celebrating, look at this, go see a physio. But if the physio then... if you then get all this influx of people with back pain, and then the physio isn't doing a good job, on that, that's false advertising, first of all. And second of all, gives us a bad name as a profession.
Yeah.
We should be very clear on how then we can help. If you want to promote this, how are we then helping those people with back pain?
Don't forget, at the end of that bulletin, they did say that it's only short term anyway.
Oh, did they?
Yeah.
I missed that bit.
Yeah, you were fuming at that. You started going red, I saw it. But towards the end, they said, just a note, this is, a lot of these modalities are temporary.
Really?
Yeah. Watch that back, guys. But that is because, once again, going back to our industry, it's like, well, we're obviously not fixing people.
Well, yeah, I know why that is.
Go on.
Well, there's... So
with back pain specifically?
With back pain... Well, not just back pain, but with everything.
If we talk about back pain, we know back pain, there's many, 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 many different factors, right?
Yeah.
That play into back pain. That you just can't account for in a textbook.
Yeah.
And
those studies.
And studies.
And those meta-analysis that they would have done.
It's impossible. Everyone's back pain is different, right?
Yeah.
It's unique to that person's back.
Because in those meta-analysis studies, and I don't know which ones they're referring to, but, having seen so many studies on back pain, the majority of studies on back pain will be centered around core exercises and the strength of the core. Right, which is not going to help someone's back pain.
It's going to work. That's such a strong correlation. You've got back pain. I need core strength.
Yeah, bullshit. Waste of time. Right?
Isn't it? Oh my God.
But those studies will show that, and we'll look like idiots for saying that because the studies say that. But again, it comes back to in practice, right? When you're actually using these studies and it doesn't work, you have to find another way. You've got a paying client in front of you that is expecting a resolution to their problem, and you give them core exercises and it doesn't work, you have to come up with another solution, right? Because they're expecting you to help them.
No, if you can't though, they see you later. They're not coming back.
Well, that's the other thing. If they're not getting results, they're not coming back.
But once going back to the problem with people dropping off, and you know, these physio being short-term benefit for back pain is because, to be honest, I think the easiest part of back pain is getting them out of pain.
Yeah, that's easy. A massage therapist can do that too.
Yeah, exactly. You treat them, you make, release the tightness and stuff like that, and you get them slowly moving. We encourage movement. Perfect. Few exercises. It's not too hard to get people out of pain. But then, like, to keep people from back pain reoccurring, you need to find what is causing that pain for that person. What did it cause? What are the true cause of the problem here? And that's where we go as physios. We go, they're out of pain. Done my job. See you later.
But again, that's come to what we're taught.
Or go and do these core exercises and you'll be fine. Then the core exercises don't work, and then what? Do they come back, or do they just find someone else, or they go, shit, physio didn't work?
But that's the problem, right?
Yeah.
That's what I'm
But that's why we're
saying.
a short-term fix at the moment. That's how we're painted there.
Exactly. And that's not the truth by any means.
No.
And I think it comes back to when you have a look at how you can help that individual. Yes. I'll take one step back before we even help the individual. At uni, we are taught to diagnose the problem. And the information we get when we diagnose the problem is, well, I've got back pain, it hurts here. And I can only talk about my experience at uni. I hope maybe it's different now. But I remember specifically tutors and in when we're sitting there learning, it's like, and maybe look at the joint above and below, right? And it's like, you should look at the joint above and below. That's still not a far enough scope. So if you're looking at the back pain, let's say it's a L5 problem or an L3 problem, so you're only going to look at L2 and L4, or are you going to then look at the thoracic spine and the hip? But then again, like, if you're only taught to look maybe above and maybe below, so if you do look at the thoracic spine and you do look at the hip, cool, there's a little bit more information you're going to get there for back pain. But still, that's not enough. That's not going to correct the problem if you're just fixing the hip and fixing the thoracic spine, if we're talking specifically about back pain.
That's right. Yeah.
So it comes back to the inherent problem, and maybe it's changed, right? I haven't seen it change in practice because we get new grads come in and we get, people with a few years experience come in.
We're changing it, James. We're changing it.
Awesome. Love that. Okay. But at the end of the day, right?
You're saying in the industry itself.
In the industry itself.
If we do not hold ourselves to that standard.
No, absolutely not. That is not helping
Switch,
someone.
That is complete. Yeah, exactly.
Yeah, that is
That's
definitely not helping someone.
Yeah.
And so I think when you ask the question, why are they? Where's this coming from, and why is back pain? And we look back at these meta-analysis studies and go, but the study says that it works, and there's a short-term fix there. The problem lies, the study is looking at one area, right? The physios are taught to maybe look at 3, but it's again only above and below the area, right? So we're not addressing the root cause of the problem, right? And we're not taught how to look at the body holistically. Yeah. I reckon, I know that there's biomechanics shoots and biomechanics studies, but I reckon if you ask any physio, how do you put all that together, they wouldn't be able to tell you. So yeah, we might look at biomechanics, but they don't know how to implement that when it comes to an injury, because we're taught, diagnose the problem, look at the joint above and below, and that's it. So these meta-analysis don't mean anything.
No.
That's why it's a short-term fix.
Yeah.
Because you're not fixing the cause of the problem to get a long-term improvement.
Yeah.
That takes time. That takes planning. That takes an outcome-driven measure that needs a buy-in from the client.
Yeah. And so research shows that 70% of people with back pain are going to have back pain again in the next 12 months.
That's terrible.
70%.
But again, why?
Well, because once again, we're not fixing the problem. And
But where does that stat come from? Like, when I say why is it reoccurring 70% of the time? Like, what's the cause of that problem? That's not normal.
Yeah, right. Yeah, exactly.
That's not normal.
Of course not. That is the population norm.
And is this 70% after getting treatment? What's this?
I think it's treatment or not treatment. It's regardless.
Well, you've pulled up from the Journal of Physiotherapy, the APA. So I'm assuming it's
you better hope.
treatment.
You better hope that there's treatment in there. So let me have a quick look.
So this stat that we're using, and I'm looking at this article, and it's in the Journal of Physiotherapy, written by the APA. Right?
Yeah. So sorry to clarify, 70% of people that have sought treatment for back pain, have looked for treatment again in the next 12 months.
In the next 12 months
with back pain,
and that is clearly in Australia.
Yes, because. Australian Physiotherapy Association, yeah.
And we're celebrating the fact that Channel 7 put go see physios, but 70% of those people that go see a physio are going to get back pain again. We should be really proud of that.
Scary, isn't it?
But again, that comes to what's the intervention?
Yeah, well, we don't know.
They've gone and sought treatment. The intervention is subpar.
Yeah, we're not good enough.
Then they've got the back pain again.
We're lucky that 70% are coming back.
I'm surprised 70% are coming back.
Yeah. Looking for treatment. Not necessarily going back to that physio again. Potentially, as we know in practice, if you don't get someone to their outcome and they have reoccurrence, it's a slim chance they're going to come back and see you again.
Yeah, I don't think we can expect them to.
Unless it's like your hairdresser and you just have got along with them so well and you're coming back for that, then outside of that, they're going to go find someone that's going to keep it off.
How many times are you let your hairdresser give you a shit haircut?
Yeah, but of course. But I'm just saying the relationship between you and the hairdresser is different. And same thing with physios. Clients and physios develop a relationship over the time. You get their back better. They're feeling good.
Are they?
Well, the pain settling down.
How long does it take to build a relationship?
And but what I'm just saying is that some of them are then going back, and if it's the ones that are coming back, it's probably because of the relationship, not because of they have trust in you fixing their back again. Because why would you go back within 12 months if your back flares up again? That is not normal.
Yeah.
It wasn't fixed in the first place. And we know at Switch, if someone comes back in with the same injury, we look at ourselves first.
100% you need to look at yourself. You did something wrong.
We did something wrong. And we didn't fix the true cause of the problem.
And we should be thanking that client for coming back to give us another chance.
Yeah. Yeah. And I know
they probably shouldn't.
I know our team, they'll beat themselves up about it and go okay, obviously I missed something here. Now I've been given another opportunity to find the real cause. I know our practitioners do see it like that. Often the client themselves will go, it's it just relapsed, and they're probably not thinking about it too much. But the practitioner is thinking, where did I go wrong?
Yeah, I think...
I couldn't even keep this off for 12 months.
Yeah, that's a problem.
Yeah.
That shouldn't be happening. That's not good enough.
Now, I think this is where it's going.
Yeah.
No, I've got a problem here though, right? Okay, so if 70% of people with back pain have back pain again after 12 months, and studies have shown that people with back pain go to physio or get treatment for 8 to 12 sessions. Okay?
8 to 12? Where did you get that stat from?
I can share it with you later.
So, in general,
8 to 12 sessions.
Physios are seeing people 8 to 12 times.
For back pain.
Yep. I don't believe that.
Okay. Well, anyway, we'll get to that.
And here's why. We used to receive, I haven't received one in a while. I don't know if you've received one.
You know what? That could be a little bit inflated thinking about that. Well, I'll have to check my stats there.
Look, if it is 8 to 12, I'd be super surprised. Right? And here's the reason why. I don't believe that. We used to receive letters from our favorite health funds, right, saying, oh, your client visit average is above the national average. We used to get these letters and we used to laugh. Because do you know what the national average that they used to put in these letters,
Yeah, I know,
our
it's like-
favourite little health fund?
Well, like 3 or 4.
Correct.
Yeah.
So, here's the first issue. The health funds are trying to reprimand us on how to do our jobs. There's number one problem. And their standards are 3 to 4 sessions. So if you're a physio out there that can fix back pain in 3 to 4 sessions, I want to know who you are. Please come and see me.
Okay.
I would love to learn what you're doing. If you can fix back pain in 3 to 4 sessions, first off. And I genuinely mean that. If you are fixing back pain in 3 to 4
obviously-
sessions, I want to learn from you.
Obviously.
So please, reach out.
Yeah.
I mean that sincerely. You're laughing, but I mean that sincerely.
Obviously, the insurance companies are just, they don't want people.
But
using
here's
their
the
card
problem,
too
though.
much.
So if we're getting pressure from the insurance company saying, you're over-prescribing, you're over-treating according to our database on the national average, that scares physios. Now, I know for a fact, and so do you, and so do a lot of other physios that work for us, that it's not possible to fix back pain in 3 to 4 sessions. And that's why I genuinely say, if you know how to do that, please reach out. I'd love to be able to help our clients in a better way. But now, if we're looking at fixing people's problems, helping them not return 70% of the time with a reoccurring back pain, there is a different approach that needs to be taken. And the approach isn't give them core exercises and a couple of squats and some stretches and hope that the back pain gets better. Clearly that's not working. There's stats that show that in the Journal of Physiotherapy from the APA. So it's not working. First of all, what you are doing is not working. Get off your high horse. Second of all, we then need to then look at, how do I get to a point where I can help this person relieve their back pain? I can give them the tools to prevent this from happening again. There is a clear pattern that has caused this back pain. I need to identify that pattern, I need to correct it, and I need to make a change. That change takes time. We know from our work that it might take 8, 12, 16, 20 sessions to change someone's negative patterns that have caused back pain. Not 3 to 4, definitely not 8 to 12. And hear what I'm saying. It's not just doing manual therapy and giving them a back rub and giving them core exercises. This is to change the cause of the problem. Change the biomechanical cause, change the habits that have caused that back pain, the overloading of the back that has caused the back to be sore. That takes time to change. You can't just say to someone, oh, do this and your back pain will go away. That doesn't happen in the real world.
Yeah, look, first of all, I've got to, that stat is inaccurate. I take
Where'd
that
you get
back.
it from?
I take that back. We're not going to talk about that. And I just quick search, I couldn't find it. But off our own stats, I mean, we've got our own stats at Switch, which we keep. You know, we know that you know, and the averages that in these letters that we get, that it can't be many. And people
They still
people
send them.
are
I haven't seen one in a while.
They do.
They do? You're a joke.
Yeah,
Health funds, you are a joke. Do not tell us how to do our job.
it's crazy, isn't it? But like, wait, so if we're only seeing them, well, how about this, right? We know that when people come to us from a doctor, when a doctor is nice enough to refer someone with chronic pain, chronic back pain, to see a physio under an enhanced primary care plan, they get 5 sessions. We are expected then as a physio to fix them in 5 sessions.
No, we're not expected to do that.
But that's what we're being.
But that's the wrong approach.
But that's
we
what
are
that's what's
not a
coming.
socialist health society, guys. We need to stop that.
But that's what's coming from the doctor.
Yeah, cool.
And,
Thank you, government, for giving us
and
fuck
the
all
government.
rebate on that.
Yeah, which is tough.
Alright?
And
But
then
that's just a nicety. That's not how you fix problems.
But what I'm trying to say is this: that we talked about the media and how their role in sort of like, you know, putting out a frame of how back pain should be, where you should go for back pain and going to a physio or not. But also when we go and see a doctor and they say, wow, you've got chronic back pain. So that means you've had pain every single day for the last 3 months at least or longer. More often than not, we know it's a lot longer than that for it to be classified as back pain, right?
Chronic back pain.
Chronic back pain, Go on, you qualify for the chronic back pain EPC. That means you get a little rebate, go to a physio, here's 5 sessions. That person with back pain has back pain likely for years. Maybe you've never seen a physio because they keep going back to see the doctor and they've taken this, taken that for it. Tried this, tried that, and they still hasn't worked.
Anti-inflammatories, they've gone and seen a back specialist.
Never know, they've probably had injections, things like that.
Yeah.
Then they get this EPC and they go to see a physio. Their expectation, James, is that this physio is going to fix me in 5 sessions.
But whose fault's that?
Well, it's the word that's getting out there. Yeah, it's
exactly from who?
Well, the government run the...
No, the government just give that to us. The government don't tell physios to fix back pain in 5 sessions.
No, I know that, but they're the ones that it's filtered down for the rebate, and the rebate's like, oh, our budget is 5 sessions, $60, whatever it is. So then naturally, then the process is to the client.
So whose job is it to change that perception?
Well, I don't know. I guess the physio itself, when the physio is in front of the client. But imagine if the doctor themselves said, here's 5 sessions. I know that it's not going to take 5 sessions to fix your back pain.
Who's going to educate the doctor
and
on
then
that?
And then so use them, but don't expect it to be right in 5 sessions. That would help this whole process.
That'd be awesome.
But then it would
whose responsibility is it to educate the doctors on that?
I don't know where you're going with this.
No, I'm just trying to say you're expecting something that needs a change. Right now, doctors don't know to say that to their clients, to their patients, whatever you want to call them, right? Doctors are giving...
Are we talking like the universities, the education?
No, it comes down to the physio profession itself. Right? If you want to make a change, if you want to see something happen, we need to be going to the doctors and educating them on that. When we go to the doctors, what do we educate them on?
Well, we do, don't we?
Here's how to treat a neck. No, educate them on what we need to do. How many times have we gone to doctor's visits and we've got to put on a fucking lunch for them and do some sort of in-service? Like, it's a waste of time, right? We should be out there.
To be fair, I think
but everyone's too scared to step on the doctor's toes. Right? Why don't you go out there and say to the doctor, hey, listen, for back pain, this is what we do. I don't need to educate you on the muscles of the back pain and all this kind of shit. This is what we need to do. This is how we do it. This is how we get results. Now,
you're right. The problem is definitely too scared to say that.
The problem is we're too scared to say that because we want the doctor's referrals.
Yes.
So we're too scared to tell the doctor that.
Yeah.
Right?
It's such an ego-driven thing too, because
100%.
when we go and do these workshops, we often wait 6 months to go and do these workshops because there is a waiting list.
And then all they give a fuck about is what lunch we bring them.
It's in the lunch break, and we have to provide lunch,
which is fine. Happy to do that.
To stand in front of them.
But again, I'm just using that as one example. Who else could help us get that message across?
I don't know.
The APA. What else are they there for? What else is the APA there for?
Yeah, okay. Well, are we going down this route now?
No, I'm just saying. I'm calling it as it is.
Of course. I think everyone's got their role to play.
100%.
But at the end of the day, no one's talking about this. No one's everyone's too scared to call spade a spade. And at the end of the day, it's hurting our industry. So yeah, it's it's the APA.
But let's celebrate that Channel 7 put something on the news this week.
It's the doctors themselves. It's the media. It's the education system. And then it comes down to this. Also, the practitioner themselves and their self-doubt, and they want to be in their comfort zone, so they're not going to rock the boat. So then no one rocks the boat, other than us, and then nothing changes. And at the end of the day, who suffers? The people with back pain.
70% of them
still-
are going back to
still
get more
got-
treatment again.
It's crazy.
But let's not step on anyone's toes. Let's not call it out how
Oh
it is.
my
Let's
gosh.
not, try and educate people to help better. Let's be called the cowboys that overprescribe and all that fucking bullshit because you're too scared to do your job.
All right, cowboy. Now listen, I've got another video for you.
Another video.
Yeah,
Oh,
this is a
wow.
little reel.
You're pulling
We'll
them
pop this
out
up.
today.
Now, this one you're going to love, guys. Watch the reaction of this after this video. So, there's your AirPod. So, Channel 7, to be fair. Again. Yeah.
Channel 7 love
This
physios.
is they interviewed the head of musculoskeletal at Monash University
Okay.
and talking about back pain. All right.
The head of musculoskeletal, like as in a doctor, like a
Yeah,
medical
professor.
professor.
Yeah.
So they're not a physio.
Not a physio.
Well, back pain is Australia's hidden epidemic, with nearly 4.3 million Aussies living with it long term. However, the biggest shock is it is costing our health system more than $4 billion a year.
Wow, but here's the twist. Many cases can be managed without costly scans or treatments. So, what do the experts say actually works, and what should you avoid to stop things getting worse? For more, we are joined by Head of Musculoskeletal Health at Monash University, Professor Rochelle Bookbinder. Great to have you with us. So 90% of us will have back pain at some point in our lives. That's remarkable in itself. What treatments work best based on the best available evidence?
Yes, so for back pain that doesn't have any worrying features, the best thing is to not seek medical care and manage it yourself. Most back pain gets better quickly, whatever we do, and self-management using hot packs, making sure that you remain physically active and don't rest for too long, and trying to do the things that you normally do, including work if you're able, or modifying things if you need to, is the best way of getting over an episode of back pain.
Okay, what doesn't work?
So there's many things that don't work, unfortunately, and most drugs don't actually work and might be harmful. So I usually suggest simple paracetamol if it works for you, although it may not work, and trials haven't really shown that it has a benefit over placebo. Anti-inflammatories, if you can tolerate them and there are no contraindications to having them. We now advise against stronger painkillers like opioids because they've not been found to be effective, again, compared to placebo, but they have lots of potential harms. And similarly, there are many other drugs that might be recommended, like drugs for neuropathy, antidepressants. All of those things don't really work in the acute episode of back pain. So it's best to try and just manage things yourself if you can.
Right. I mean, there's so many people right now thinking I've had this pain for so long, I've been trying to manage it, I can't manage it myself. But you also say that unnecessary imaging can cause more harm than good, X-rays and MRIs, stuff like that.
Yeah, so that's part of the problem. We know that many people with chronic back pain have had a variety of imaging tests, and most imaging tests, X-rays, CTs or MRI, will find abnormalities because most normal people have them as well. And in fact, the abnormalities that you see on imaging are almost as common in people who don't have symptoms as in people who do have symptoms. And the troubles with having the imaging is that some people might therefore assume that that's the cause of their pain and go down paths that are not helpful, such as surgery, back injections and things like that. When again, the best thing to do is try and avoid most of these medical interventions.
Oh, interesting. So they'll find something anyway. That's a really good tip. Thank you very much, Professor.
I've had enough. Who gives people this time of day? So
Okay,
we started this with saying,
The imaging
if
part.
you have a little niggle, it's okay, just self-manage it, which is fine. You can absolutely self-manage it. I'm not against that. but then say, oh, but when you have chronic problems, oh, well, now we don't go get it sorted. Like, don't get imaging to find out what the problem is. This is a contraindication. This is a massive contraindication. I don't know why people get this time of day.
I couldn't wait to show you that.
So first of all, guys, first of all,
how damaging is that? That's
you have
ridiculous.
back pain because there is a problem.
But don't do anything about it.
Why is that why is that the advice that she gave? I'm not saying to go see a physiotherapist. This is not a promotion by any means. But if you have a problem, if you have back pain, there is a reason for it. Now, it will go away by itself. Absolutely it will. And then it comes back again. And then it will go away by itself. And then it comes back again. And then it'll go away by itself. And then it comes back again and you're fucked. And then we call it, chronic back pain. Your body told you 3 times there's something wrong. You ignored it, and then you're being told by a professor to do nothing about it. And then when it's fucked, then we need to go get surgery. We need to go get scans. We need to go take opioids. We need to go fucking get 5 sessions from the government. Why didn't we try and prevent the chronic problem before it happened? When the first instance of back pain, yes, it will go away. And yes, maybe you didn't need a physio to get rid of the pain, but maybe you needed a physio to say, hey, this is why you're getting the back pain. Here's what you need to change. Here's how to do it. Here's what to strengthen. Here's how to change your movement patterns that are causing this. These are the issues that are affecting your back. No, but let's wait till it to give you a chronic problem and then cost the government more, cost the individual more to go get treatment. Right? Yeah, maybe you could have fixed it in 3 sessions the first time you had it. But now that it's chronic because the professor told you to leave it, now you're going to spend a shitload of money fixing the problem.
Yeah.
And yeah, you don't need scans, but now that it's chronic and you've had it for years, maybe you want a scan to see what's going on because there is a problem.
Yeah.
That she inherently started because she told you not to go get it fixed. How fucking stupid is that? Oh my God.
Oh.
But let's
I
not
knew that would fire you
let's
up.
not
I'm so glad you didn't bring any prep for today because I'm just going to do this more often, guys. Just going to throw the bait.
This is what's frustrating. The frustrating part about that is that's what majority of people will do. Because that's the evidence that's like you talked about the messaging. So that's the messaging that's out there. It will go away, and it will. Like I'm not here saying you get the slightest twinge, you need to go see a physio.
Yeah,
all right. We don't need that, all right. But at the same time, don't blame us when it gets chronic and it's going to take ages to fix, and then you go, oh, well, why do I need to come in so many times and get it fixed? Because you ignored the problem for so long.
Yeah,
and now it's a chronic problem. Now it's going to cost more.
Yeah, I completely agree. And
just one more thing.
Go on.
Pain is an indication that something is wrong. Don't ignore it. Our body doesn't send pain signals because all of a sudden it will go away by itself. Our body sends pain signals because there is a problem. It is up to you to sort it out. You don't have to. Yeah. But it's up to you to sort it out. And then if you don't whinge when the physio then tells you this is going to take 3-4 months to fix when you've had back pain for 2-3 years.
And tightness precedes the pain.
Yeah.
So like we know when things are coming. You know when it's like, oh, my back's not feeling right. You know it when something's going to happen. We need to be more proactive as a society. I think what's crazy is the self-management part. I just can't get past that.
Yeah.
I just can't get past that. I know you didn't want to promote physio, but this is what when I watched this earlier, this is what hurts me because don't put our profession down like that. We can help, and it's not a bad thing to see a physio once, get it sorted, and then see them ongoing to make sure that if you've got back pain, there's a 70% chance, even if you've had treatment, that it's going to come back within 12 months. So why, as a physio, are you going to be discharged to self-management after the pain's gone? And then good luck. We'll see you next time within the next 12 months. Maybe not. highly chance that you are going to come back with the same problem.
And then blame us.
But then, have you seen the stats?
This is a typical doctor in a sick care system. We need to get rid of the sick care problems, the sick care system, and start doing preventative health.
That's right.
Plain and simple. Because then we're going to whinge about it down the track.
Yeah.
Typical doctor in a sick care system.
He's lost the plot, guys.
Oh, that's
this
frustrating.
is so good. Yeah.
When was that posted?
I couldn't find out.
Wait, sorry, you were going to say
But
something.
no, I was just... You okay?
I'm
First
good.
of all,
I'm good.
you want some water?
I'm all right.
What do you think, guys? Do you think I should just do that more often, or do you think I should pre-warn him? Is it a bit too much?
Just tell me you were going to say something
Anyway,
about
no,
another stat that you found.
No, look, yeah, I found another stat. You'll love this one, right? So, more often than not, like the back pain, like you said, yes, we know it will get better, or like sometimes just heal on its own. Like not heal, but it will feel better on its own. How long do you think it takes someone to come in to see a physio?
Once they get back pain?
Once they get back pain.
The very first time?
First time they see
or
the
like
physio.
a chronic reoccurrence?
No? I don't know about that.
Because
If you've got back pain, when are you going to book a physio appointment?
people wait ages.
Yeah. Crazy. I thought it was longer, but the stats I found was actually 14 days.
14 days from the start of back pain.
Yeah.
But are we assuming, though, that that's because the back pain hasn't gone away?
Correct. So if it gets better within the first 14 days, good on you. That's fantastic.
Well, that's what she told you to do.
But yeah, that's it. Don't do anything about it. Just
The
be prepared. It's coming
said
back
just
again.
leave it.
Yeah, professor said just leave it. But be prepared. It's coming back because the true cause of the problem is still there, right?
Yeah.
And it hasn't been fixed. The pain, your body's just worked out a way to adapt, compensate, and then carry on with your life, right?
Say that again, because that there is the key. The body has what?
Your body has worked out a way to adapt, compensate, and move on with your life.
And
that's
guess
why
what?
your back pain is better.
That fucks you even more.
Yes. It makes you worse for the next occasion.
So then this stat, 14 days, is 14 days of suffering with back pain. It hasn't gone away.
Yeah.
So then they're
So
like,
then they're
I
like,
need to go do something.
Yeah. Correct. And that's when to be fair, I think that was quite short. I've seen people in like they've been struggling for a while, but on average,
we're talking about
days.
but it's come and gone.
Yeah.
So what we're probably thinking is like people come to us and go, I've had back pain for years, or I've had back pain for months, but it's coming and going for years, or coming and going for months. Then this seems to be like they've had back pain for 2 weeks and gone, I need to do something about it. Okay.
Correct. Then if we're seeing them for however many sessions, right? How are physios then okay with themselves, feel good about discharging someone when we know that 70% of them are going to flare up?
Mm-hmm.
How are we okay with that as an industry?
Oh, because we don't want to overservice.
Well, we don't want to do what we wanted to do when we first came into this industry, which is help people.
Yeah, we're not helping people because we're too scared.
But then we feel better as physios, generally feel better about giving them exercises. You're out of pain. Here are a load of exercises. Look at this sheet of stick figures that I've drawn for you, or whatever, right? These how many reps and sets, do it for the rest of your life and you'll be fine. How many, and I feel good. I'm a physio. I've got them better and I've got them to self-management. That's the goal. Fantastic. How good am I? I've done my job, right? That's the general consensus of physios, okay? So then I found a study
here we go.
on how the adherence to exercises.
Love this.
What do you
There's
reckon?
an actual study
Don't
on it?
look- hey.
I can't see fucking knocking the microphone too.
What do you think?
Sorry, Simon.
So exercise and self-management focused
The
studies.
best form of treatment.
Focus studies. What was the percentage of people that were non-adherent?
Non-adherent.
Yes.
80%.
75.5.
Mate. Fuck, spot on.
75%. So then 24.5% are doing what
Doing
you
the
said, doing
exercises.
the list, right?
Yeah.
So that the ones that you discharged, 24% of them are doing what you said.
Yeah.
You think 100% are doing them, and you're feeling great about
You're
yourself.
feeling so good about yourself because you gave them core exercises.
But only 25% of them are actually doing it.
Yeah.
And then 70% of them are going to come back. Probably not to you. If they come back to you, that's a gift.
It's a good business model.
But they're going somewhere
Don't
else.
fix people; they'll keep coming back.
Yeah. That's a whole nother thing, because then we're not educating people.
Sorry,
on
I can't
like
use the
true
word
cause.
fix. That's a trigger word. Don't help people and they keep coming back.
Yeah, that's right. That's right. You treat them at the start. You used to treat them in January. They're coming back in November. Same problem. You've got another
Amazing.
You got
business
another
model.
10 sessions
Did we
in
learn
both
that
ends
from
of the year.
Kairos?
Yeah, except you've exhausted their health fund, and they're so upset. They're even more upset this time because it didn't get better. They're more anxious. It's affecting them more, and they're worried about that this is just them for the rest of their life. How often do we hear that?
Yeah. And then they got to go get surgeries, and then they got to
Yeah.
go take time off work, and then they got to do all this. Yeah.
Do I need an injection? Am I going to be like this for the rest of my
Yeah.
life? What do I need to stop doing? Blah, blah. Catastrophize. And physios go, oh, well, I know how to get the pain down. I'll get the pain back down, and I'll get you to self-management. I'll give you this list of exercises, and then I'll see you later. And I feel so good about myself. But I know only 24% of you are actually going to do it.
Well, no, they don't know that.
They don't know that.
I reckon
now they do.
95% of physios would have zero idea that exists.
But hold on a second. We were just told by the professor that that's what we should be doing, just self-management.
Sick care professor over there.
Yeah. Let alone those exercises. We're not even talking about those exercises aren't even going to fix the true cause of the problem anyway.
Yeah.
Why do we then discharge? Why don't we just carry on? Listen, you're doing really well. You're out of pain, but to actually change the true cause of the problem and to unteach those bad movement patterns that have caused the pain in the first place, it's going to take time. You're 30, 40, 50 years old, whatever. It's taken that long for those movement patterns to develop to cause you the back pain, not the 2 weeks ago when you bent over and picked up your daughter and then you got the back pain. It's been developing over time. Then you're not going to fix that and turn it around. Turn that around in a couple of weeks' time or 6 weeks' time or whatever. That's going to take a long period of time. So why don't you work with your physio over a longer period of time? Doesn't have to, and I'm not talking, let's make sure we, increase. I'm not over servicing. I'm not saying like, let's just keep treating people week by week by week by week. I'm saying that's when you have a management plan after your treatment and you focus on the true cause of the problem. You're teaching new movement patterns. You're improving someone's movement and getting them to be able to be more efficient and more bulletproof.
Being preventative.
And you know what? That's then going to be more cost effective in the long run because they're not going to come back for 6 or 10 sessions every time they're concentrated 2 or 3 times a week when they can't when they're in like debilitating back pain and they can't pick up their
but it
daughter.
comes back to something you said that was really, really key that majority of people would have missed, right? Is that how you analyzed the problem to begin with. You said that this is something that developed over a period of time, 20, 30, 40 years. Yeah? And then they come in to seek treatment because the pain is unbearable. And then we're expected to undo that in a couple of weeks. Well, private health insurers wants you to do it in 3 sessions. So in 3 sessions, we need to undo 30, 40, 50 years of poor movement problems that had led to the pain. That there is the problem. That there is the key. Instead, we're diagnosing, you have back pain. Here is a set recipe to fix it. Though that person, so if you and I walked in to get with back pain, your cause of back pain, your movement patterns, the way that your back pain comes on is very different to mine and what's going to happen to me. So if you and I get the same core exercises, the same back massage, the same, maybe hip strengthening exercises, one of us might feel good. Doubt it, but one of us might feel good if we then adhere. If we're the 20%, likely one of us might adhere to the exercises. All right, and then on top of that, you're hoping that I'm then not going to go back into those poor movement habits. That those strength exercises that you gave me, all right, are going to change what's caused the problem to begin with. So the diagnostic problem that right there is that we're diagnosing the pain and not diagnosing the cause.
Absolutely.
That is the number one thing there. And that would have been missed by everyone. Because then if I'm changing 30, 40 years of poor movement patterns, that's how I prevent back pain from coming back. That's how I stop that person from experiencing back pain. And that takes time.
And that's why studies will not be relevant in that sense, because each person's movement patterns are completely different.
Exactly.
Into a study.
If you've got a cohort of,
if you've got back
this
pain,
meta-analysis that Macquarie University did, all right, there would have been 20,000 people, because they've done so many different studies, right? Maybe 20, 30,000 people all together as the whole meta-analysis, right? That is 30,000 different movement patterns. There is no way to blanket treat 30,000 people.
No. Yeah, and I must say, I do hold, we hold a lot of pride in that. At Switch, that is our passion, as you can tell. Finding the true cause of the problem for the name at the top, like the name at the top of our document, that's the most important thing.
Yeah.
That's our diagnosis.
And we need to be, but the diagnosis is a sick care model. Move away from the sick care model, start working towards a preventative health model.
Yeah.
Someone has come up in with pain, so yes, we need to treat that pain and we need to help them get out of that pain, right? But that is a sick care model if you stop there.
Yeah.
If you genuinely want to help people, learn how to then prevent that problem from coming back. Find what caused that problem to begin with. Work on how to prevent that problem from coming back. And there is no one that can do that in 3 sessions. And please reach out if you can. I would love to fucking know. Genuinely would love to know.
It's not possible. It's not possible. And look, for the client themselves, we know how debilitating back pain is and how many other factors, we're not going to go into that, but how many other factors that back pain can cause. If you've got back pain, it's associated with mental health issues, depression, anxiety, and you might not be able to go to work, then you can't pay your bills, and
but we're not
you can't pick up your kids and all that stuff. I know I'm not, but I'm just saying, imagine doing that twice a year for 2 or 3 weeks period, all because the system's failing you.
Yeah. But
whereas, why can we just...
It could also cause shoulder problems. It could also cause neck pain and
That's
headaches
right,
and all those kind of things. All but because Miss Monash, the professor, said, just leave it.
It's not right. It's not... You don't have to leave it. You don't have to put up with that. Yeah. That's not good enough. And
sick
as
care
physios,
system, get away from the sick care system. If we come back to that original article at the start where we're celebrating how we could help, and then at the end there they sneak in, but it's not long term... Get out of the sick care system. Start helping people prevent movement problems. Don't be scared of over-servicing. It is an agreement between you and your client. If you present a plan to help someone and they agree, that is not over-servicing.
Yeah.
You are then genuine, if you're genuine about helping them too. That's the other thing. Don't just fucking do it for a cash grab. If you're genuinely about helping them and it takes time, then you will then be moving away from a sick care system, helping people invest in their health, prevent injuries, because then you're not just fixing the back pain, that's what they came in for. You're preventing knee problems, you're preventing shoulder problems, you're helping them if they want to then, lift a PB in the gym, you're helping them if they want to then go do a marathon, because you're taking an active approach in preventing injuries as opposed to just treating them when they fuck themselves.
And that's what our clients want. That is then more cost effective for the client, because they're not having these reoccurring injuries where they come in 2 or 3 times a week, and then that's debilitating. You're preventing other injuries, so they're not coming in for that, and you're going on a journey with them. That is the most exciting part. You're making them realize that they can do this, and this, and that concern that they originally had isn't going to hold them back.
No.
And it's not normal to have back pain, even though 90% of the people
will experience back pain.
Have back pain at some point in their life. All right. Cool the Jets.
Cool the Jets. Oh, jeez. I can talk like all day about this. Like,
yeah, obviously it gets us riled up a little
you know
bit.
what? I'd love to maybe we've got to do this. I'd love to have someone on that would oppose our view on this.
Yeah. Anyone out
If
there?
you oppose our view, come, let's have a chat. And it would be a respectful chat.
Yeah, of course.
But I really think that if you think what we're saying doesn't make sense, or you have an alternative way of doing this, let's have a chat. It's going to be to the benefit of our clients.
Yeah.
Because you know what's going to happen? We're going to bring someone on and they're going to have a differing view, and we're going to be able to have an open chat about it. And then the clients are then going to choose what's going to work for them.
Yeah.
It's going to benefit.
Yeah.
I'm not saying we're right.
Yeah.
I'm just saying what I've experienced in private practice.
Yeah.
I'm just saying how I feel that we've been able to best serve our clientele.
And the better our quality gets in terms of our service, the better this back pain is gonna be for our clients, but and for our population. And then we'll see in the media.
maybe
Physio
there'll be
back on the top.
That's all you care about.
I know that didn't get you. It pulled a few strings with me, but I got a bit upset about that. But yeah, look, I think I mean, there's so much more to this, but let's get someone on. I'd
love to have someone on to talk about this. If you believe everything that we said was wrong and you have an alternative approach, reach out.
Because we're obviously still learning too. We wouldn't say we've got things perfect.
No,
but
we can't.
We're doing our best. We would, and like I said, when our practitioners get someone back with the same injury, I beat themselves up respectfully, because they're like, well, what did I miss? I've missed something. That's on me. That's accountability as a practitioner. I go, I've missed something. Okay, well then what is it? And that's going to make that practitioner better for the next time.
Exactly.
The detail in their movement, in their assessment is super, super key. It's not just, yep, you've got back pain. That's what it is. All right, James.
Agreed.
Cool the Jets.
Another question, right?
Well, we always finish off with a sporting question. And since we've had the Origin series recently, I wanted to ask you, James, like, everyone gets around the Origin every year. I look forward to it. I think it must be the most watched sporting series in Australia, right? And
it'd have to be.
It's a pinnacle,
close,
right? Yeah, it's a pinnacle. And
Australian sporting series.
Australian, yeah. I just think it's gone a bit soft.
It's funny you say that because, like,
I mean, I'm not a hard man. But I would never go out there. There's no chance.
No, fuck no. Look, it's funny you say that because I said to Adriana when we were watching it, right? She's like, oh, I'm surprised you're so into, like, the State of Origin. And I'm like, it's still fun to watch. Like, State of Origin's still fun to watch. Yeah. And then I was like, I used to watch rugby league all weekend. Like, as a kid, Friday night footy, Saturday night, if we were at home, the football was on. I remember watching so many games. And then I agree, like, something's different in the game. I don't know. Even watching the State of Origin, I'll still watch it every year. It's the only game I watch. I don't watch any other rugby league. Right? I only watch State of Origin.
Yeah, which a lot of people do.
But something is off. It's not as fun to watch. It's not as entertaining as it used to be. I think, like, and it's funny because, people will say that, we love football, we love soccer, right? And people are, that's not entertaining, right? But
soft as it comes.
Yeah. But, and there was a lot of tries in the second game and all that kind of stuff, right? I get that maybe that's changed. In previous Origins, you're not going to get a massive scoreline like that, right?
But they were bloodbaths.
But yeah, like, I just feel like the game is just different. I don't know. I didn't really like it. What are your thoughts? Like, I know you didn't like it.
I want to see the punch-ons. I want to see...
That's all you care about?
I want to see, like, I love the loyalty. I love the, like, you're playing for your shirt. We talk about that at Switch with our staff and about playing for the shirt.
Yeah.
And I love seeing that in Origin. There's not many sporting teams that play for their shirt that strongly, and I love that part. And I love that when people get up in the face, they don't back down and they go at it. And yes, like that would lead to multiple punch-ons and fights and things like that. But it was just like this like pride in the shirt, and that's where it came from. And I think there's still pride in the shirt. Don't get me wrong, I'm not saying that, but I just feel like you know, we talked about that they're high scoring now. They would previous years they would defend that line like it was, you know, they're saving, I don't know, protecting gold or whatever, right? They would just die on that field. Now we're letting in tries. I'm like, what's going on here?
Yeah.
Like, yes, I get the skill part and I get the plays and things like that, but I just want to see the bashing.
I guess it's interesting because like you're talking about the physicality of it.
I still love it.
And why you're disappointed. I'm talking about, I guess, the technicality of the way the game's changed. Like there's all these new rules, man. Like, and for someone that doesn't watch it every week, I'm watching it going, what the, like that was allowable 5-10 years ago when I used to watch, and now there's some rule around it. That's the bit that I don't get. You know, that's where I've lost the passion. You've lost the passion of it because there's that rivalries. But the rivalry I think is still there. I think they're just not allowed to enact it though. Is that what it is?
I think so. And they're getting caught out if they do.
Yeah.
New South Wales did it in the second game, and they got caught out. Like they tried to like ruffle the feathers and stuff, and they were conceding penalties, and it was like, well, then that we end up losing the game essentially because
like
of that.
Some of those penalties, I don't even know what they were for. Like again,
some of them were like elbowing on the floor and
that's
gouging
fine.
and stuff like
that.
that.
I get that. That's understandable. But there was some penalties in that game.
Yeah,
even in the first game,
ill-discipline. But
it was like I just didn't understand what those penalties were for. Yeah, because when I used to watch the game like every
it's
weekend,
so fast now. That's why they're trying to make it faster and faster and faster. Like the 6 agains, they just happen all the time. But yeah, and I love the speed of it. Don't get me wrong.
Yeah.
But yeah, I just love the passion for the shirt that was shown in the biff, in the physicality, you know. And no, you can't do head. Obviously, I know they've got their
the
reasons.
I get
head
that.
high, and I know that's a problem. And I just don't think we're striking the right balance.
Yeah.
I just want to see. Origin should be its own ruling, just a little bit different, I reckon, in the Origin.
Yeah.
Let the guys punch on one-on-one.
Yeah.
No run-ins.
It is Origin.
Let them do the shoulder charge.
For you about Origin, right? So compared to like previous years and like, you know, I guess the way the game was to the way it is now, right? How many times, you know, we both love football. We've both played football.
Yeah.
And I remember growing up, you know, anyone that played rugby league or rugby union, you say, oh, you guys just fall on the floor and, you know, all that kind of stuff.
Yeah.
All the play acting that happens in football, right?
We've copped it our whole lives.
Yeah.
Yeah.
Mate, watching rugby league these days, there is a lot of play acting.
Way too much.
What the hell is going on?
It's going a bit soft.
It's like... But even play acting to the point where, like, players...
Holding the back of my head.
Yeah.
Crush and tackle. Yeah, we'll look at that.
It was in the second game, I think it was Nathan Cleary's try that got disallowed, right? I don't understand the rules, so what I'm about to say might be complete bullshit, but I think it was like a shepherd, right?
That's right.
One of the New South Wales players that's walking backwards
correct.
blocked the Queensland player from tackling Nathan Cleary.
Yeah.
But... I don't understand. Like, if we're in line, right? So the defense is over there, like the goal line's over there. I'm the Queensland player. You're the guy backing up. Nathan Cleary's running that way. Why would I run to you to block the bloke that's running that way?
Oh, you're
Why
saying...
did I run that way?
Because he's going for the penalty. Yeah, I know what you're saying.
That's play acting.
100%.
So, like, if I know how to play act, I'm gonna touch you and go, oh, you stopped me.
You blocked me.
But I gotta stop. I gotta block him going that way. Like,
well,
stuff
it's
like that.
hard to say that when we come from football, man.
I don't know the game.
Coming from soccer background, you're the softest.
Come on, mate.
I've never dived in my life.
That play acting,
was
always reserved for football, soccer.
It was discouraged.
And now we're seeing it in rugby league.
Yeah, and it was shown as like, oh my god, like you, what are you doing? You know. Yeah. But now with the cameras, like they can pull that clip back and go, oh, was there obstruction? Oh yeah, there was. Oh, we can't. What's the rule book say? Yeah, he was in line with him. Oh, we can't do anything about it.
Yeah, but why am I tackling you when I got to tackle the bloke scoring over there?
I know we're losing a bit of that honesty, which I
Yeah.
was definitely in rugby league.
I reckon it's. I haven't watched
Rugby-
a game of soccer
Obviously-
where it was that bad.
Oh,
Come on.
Come on, let's be honest with ourselves here. We run up to that referees with arms up and come on.
What were
I
they
hate
doing?
that in soccer.
What
I
was that?
can't
What's the
stand
captain
that.
of
Just play
the
with an honest
Queensland?
game.
He's the captain the last
Munster?
couple games. Yeah. Mate, that bloke's up in the referee more than freaking any soccer player ever is. With that hair flopping about everywhere. Like, come on, man. Have you ever seen an Italian do that?
I'm saying it's changed.
That bloke must have learnt from the Italians down in Melbourne.
Italianos, yeah, that's it. Oh my god, where we all learnt, to be fair. Look, I mean, I still love rugby league. I just think we got to leave Origin.
Yeah, like I said,
Would
that's all I
you?
watch, so I don't know.
I like this hypothetical. If I give you $1 million,
Yeah.
I'll give you $1 million if you took the first hit up in State of Origin. Would you do it?
Ooh.
So
Well, it would pay for my medical bills.
yeah, you do it. You do it for sure. But you know what I'd do? I'd get the ball. You'd catch the ball. You'd throw it to me, and I'd run up, and then I'd just trip over, and then I'd have to put a hand on me, or even if they laid on me, sweet, $1 million.
So you're hoping that there's a fuck up.
No, I'll just trip over. I'll just pretend. No way am I going to run into one of those big forwards. No way. I'd die.
No,
Forget
I don't
about
think I
$1 million
could do it. I don't think I could do it. No way.
No.
Those guys are like,
I'm calling it
big
soft,
boys.
but I wouldn't even take a hit up.
nah. But we're allowed to call it soft. We're spectators.
That's right. That's right. Exactly. Armchair supporters. All right, James. I've had enough of you.
Thanks, Harrison. I had enough for you too, mate.
Until next time.
Thanks, guys.